Hi, I'm Sue Baker. I'm the Director of England's anti-stigma programme called Time to Change, and I'm here with
Lisa Rodrigues, and I am a campaigner, mental health campaigner and a writer. I started my NHS career 41 years ago, stopped being a Chief Executive of a mental health trust last year, and I am working as a volunteer with Sue on a programme at Time to Change.
And we're both very open about our own lived experience of depression, aren't we?
Absolutely.
It's really important in the work that we're doing to change society and to support employers that we who've been there and continue to live with mental health, as we all do in one way or another, are really open about our own journey and our own experience.
Absolutely, and at the workshop that we've been at today, I was talking about my experience of depression and anxiety, off and on since the age of 15, including a really major breakdown that I had in the year before I retired from the NHS, which wasn't the reason I retired. The breakdown was because I was retiring and I was experiencing anxiety about loss of role, really, which is so key to this whole conversation, because work is so much a part of who we are and what we do, but we need good mental health in order to do good work. So I have a saying, it's not them and us, it's about we. And the programme that I'm working on with Sue is about making sure that mental health in the workplace in the NHS becomes something that we can all talk about much more readily.
Because what we're finding is that employers in all sectors are focusing on the mental health of the whole workforce as part of whole workforce well-being. So I think historically employers have been lacking in confidence, lacking in awareness of knowing where to go to get specialist help, and really not understanding that mental health isn't just the 1 in 4 of us who experience it, it's the 4 in 4 as well. And as we were just saying in your workshop, often it has taken a crisis with the loss of someone's life or somebody being really unwell and needing to take time off, which isn't always the case, in order for an organisation to focus and realise that mental health is very prevalent in every single place of work in this country. But the good news is that employers are coming on board in their droves. Actually, employers get the business case, so they know that it's going to help the bottom line, and we are working in partnership with all kinds of employers now, small, large, medium-sized, the finance sector, the entertainment industry, educational establishments, national government departments, you name it, energy suppliers are getting on board. But the one thing that they need is the confidence to open up conversations in the workplace. But the good thing is that once you start those conversations and you change policies and practice, we know that helps staff performance and the bottom line. So there's lots of really good examples we're talking about later today, aren't we? But the NHS, perhaps we need to work a bit harder.
Well, we do, and the NHS is under huge stress at the moment, isn't it? And it's a wonderful service, and I don't want anybody to go away from watching us talking to think that we don't understand the stresses that NHS staff, NHS managers, NHS leaders and politicians who support the NHS are under, and of course the experience of patients. However, it is vital that we think about the well-being of the NHS workforce, because if staff are not feeling supported in this very stressful work that they do, they're not going to be able to give the best of themselves. And my learning about my own mental health is that if I am not kind to myself, I then can't be kind to other people. And we know that patients value compassion from staff above almost all other things. Expertise is really important, but if you don't support that with compassionate care, then the expertise can really go wasted. So the programme that we're going to be looking at in the NHS is about making sure the NHS supports its workforce in ways that are more positive perhaps than we've done previously, making sure that people understand that talking about mental health is something that everybody can do, but also that people who've had experiences of mental illness are assets rather than people who are in the team who you have to look after. I think I'm a stronger and a better person from my experiences. I'm pretty certain you are too, Sue, because we've learnt so much about ourselves and we've learnt how to be in teams. So I think it's great, but we've got a way to go yet, haven't we?
We have, and so we definitely need to take the initiative and to work in partnership. So we're never here to lecture anybody about this is the one prescribed way to be a better employer on mental health and wellbeing grounds. and these are the things that you must do. Obviously everybody has a choice and everybody tailors it according to need, but the important first step is to recognise that mental health is in every single workforce. And as we've been hearing today in many of the key speeches, employers are also beginning to recognise it's not about the cost of sickness absence, which is the only issue. There's a bigger cost to all employers, including business and health service providers, of presenteeism, when you're not getting the maximum performance and engagement from staff, which can affect how you engage with patients, how you talk to your customers, and how you perform at work. So the key issue is about high levels of performance and engagement, as much, if not more so, than it's about looking after people if they develop mental health problems, but the two go hand in hand.
They absolutely do. It's brilliant to be working with you, Sue. Thank you.
And you, and to be at the conference.
Yeah, thank you.